17958. We're looking at a 40-year-old patient before and 3 months after liposuction of the upper and lower abdomen, as well as the flanks. And this was with Renuvion skin tightening. And again, you can see a tremendous improvement in the abdominal area and the flank area. And this is an example of the 360 liposuction where the entire waistline is reduced by going 360 degrees around the patient. And another example of how Renuvion, which is this radiofrequency technique that can help us tighten the skin, where it looks like she's going to have a lot of extra redundant skin in the abdominal area. If we had just done liposuction alone, combining that with Renuvion, we can really help mitigate the need for doing an abdominoplasty, which is much more invasive procedure. And you can see she's had a really good outcome with a combination of the two procedures.
And this does show also a very nice tightening of the skin. So that wrinkly look in the lower abdomen is, definitely improved. And we have mentioned before that, there are examples where we do have to do, we call it more of a mini abdominoplasty. And that's where the very lowest, part of the abdomen, if there's just an extra fold of skin, that we will do that. A lot of times we'll start with the liposuction, with or without tightening, such as Renuvion. And if there is still some redundant skin, we can accomplish its removal with a very simple procedure. It does require excision with stitches, but the procedure is much smaller than a standard abdominoplasty. One setting we often see that extra folded skin is in someone who has had a previous surgery, such as a C-section. That scar they get from the C-section is a lot of times kind of bound down, and then the skin right above it can just fold over and hang. And when we excise it, we just use that existing scar to make that incision, and that way there's no additional scarring. The scar they had to begin with is pretty much what they're left with after that mini abdominoplasty.